Today we're talking about a condition that affects more than 280 million people worldwide: depression. But what exactly is depression? How is it different from feeling sad? And how can someone deal with it or support a loved one who's going through it? Let's dive in. Depression is more than just a low mood or a bad day. It's a serious mental health disorder that affects how a person feels, thinks, and handles daily activities. The medical term is major depressive disorder. It can last for weeks, months, or even years. It's not something people can just snap out of. So, how do you recognize depression? Some of the common symptoms include persistent sadness or emptiness, loss of interest in activities once enjoyed, fatigue or low energy, changes in appetite or weight, difficulty sleeping or oversleeping, trouble concentrating, feelings of guilt, worthlessness, or hopelessness, physical symptoms like headaches or digestive issues. In severe cases, thoughts of death or suicide. Not everyone experiences all of these, but if several symptoms last more than 2 weeks, it's important to seek help. Depression isn't caused by one single factor. It's usually a combination of things like biological factors, chemical imbalances in the brain, especially involving serotonin and dopamine. Genetics. It can run in families. Trauma or stress, including abuse, grief, or major life changes. Chronic illnesses, such as diabetes, cancer, or chronic pain. Substance abuse, alcohol or drug use can both trigger and worsen depression. It's important to know, depression can affect anyone, regardless of age, gender, or background. Depression is diagnosed through clinical evaluation. There's no blood test or scan for it. A mental health professional will assess symptoms, duration, and impact on daily life. They may also check for underlying medical conditions like thyroid issues or vitamin deficiencies that can mimic depression. Sometimes questionnaires like the PHQ-9 are used to help assess severity. What is PHQ-9? It is a simple screening tool doctors use to check for depression. It's called the PHQ-9, or Patient Health Questionnaire 9. It asks just 9 questions based on symptoms people commonly experience when they're struggling with depression. Let's go through them. 1. Over the past 2 weeks, have you had little interest or pleasure in doing things? 2. Have you been feeling down, depressed, or hopeless? 3. Do you have trouble falling or staying asleep or sleeping too much? 4. Have you been feeling tired or having little energy? 5. Have you had poor appetite or been overeating? 6. Have you been feeling bad about yourself, like you're a failure or have let yourself or your family down? 7. Have you had trouble concentrating on things like reading or watching TV? 8. Have others noticed that you've been moving or speaking more slowly than usual or the opposite, being unusually fidgety or restless? 9. And finally, have you had thoughts that you'd be better off dead or of hurting yourself? Each of these is rated from 0 to 3, depending on how often you've felt that way. 0 for not at all and 3 for nearly every day. Your total score helps doctors understand how severe your symptoms might be, from mild to moderate or severe depression. If you recognize yourself in these questions, don't wait. Talk to a healthcare professional. The PHQ-9 isn't a label. It's a tool to help you get better support sooner. Your mind matters. And you're not alone. The good news is, depression is treatable. Treatment varies depending on severity, but common approaches include therapy. Cognitive behavioral therapy, CBT, interpersonal therapy, psychodynamic therapy medications, antidepressants like SSRIs, e.g. fluoxetine, sertraline, or SNRIs. These take a few weeks to work and should only be taken under medical supervision. Lifestyle changes, regular exercise, healthy diet, good sleep hygiene, limiting alcohol and caffeine, social support. Alternative therapies, meditation, yoga, art therapy. In some cases, brain stimulation techniques like ECT or TMS may be recommended for severe or treatment-resistant depression. If someone you know is struggling, listen without judging. Encourage them to seek help. Offer to go with them to appointments. Be patient. Recovery takes time. Never ignore talk of suicide. Always take it seriously and seek emergency help if needed. Sometimes just being there consistently is more powerful than you think. Depression is real, and it's common, but it's also treatable. If you or someone you know is struggling, please know you are not alone. Help is available. Talk to a doctor, therapist, or someone you trust. Let's break the stigma around mental health. One conversation at a time. Thanks for watching. If you found this video helpful, don't forget to like, subscribe, and share it with someone who might need it.